Hi, Carolyn here, trichologist, Absolique Hair Health Clinic. Today we're going to talk about postpartum alopecia. So what that actually means is post-pregnancy hair loss. Now a lot of women don't realise that throughout pregnancy, especially the last trimester, you don't actually lose your normal quota of hair. So in the last trimester of pregnancy, your telogen hairs, which are your falling hairs, they do not fall. They all remain in the growing phase, and that's part of the pregnant glow. However, 3 months after your beautiful baby is born, after your cycle resumes, or after you stop breastfeeding, it's a little bit different for every woman. Those hairs that did not fall will fall along with your normal daily hair loss. So what this results in is double the amount of hair loss. So we all lose between 70 and 160 hairs per day. So just say you lose 150 hairs per day normally, you're now going to be losing 300 hairs per day. And that appears to be a lot. So let's talk a bit about the hair cycle. The anagen phase is the growing phase. Catagen is resting. Telogen is falling. The hair falls and it returns back to anagen. In the last trimester, the hairs do not fall. They remain in the growing phase. 3 months after you've had the baby, your cycle resumes, or you stop breastfeeding, normal hairs will fall, and the quota that did not fall will also fall. So post-pregnancy hair loss. This is part of every pregnancy. It's got nothing to do with health or nutrition or any other problems. It is just part of pregnancy. The problem with postpartum alopecia is there can be other problems at the same time. So I see pregnancy diabetes a lot. That can affect the hair cycle as well. We have thyroid imbalances throughout the pregnancy, and another big one is iron deficiency. And the other thing is the nutrition of the mother. All of the nutrition is going to the baby during the pregnancy and then also during the time of breastfeeding. And the mother's not sleeping much because she's up feeding this beautiful new baby. So it does affect the nutrition of the mother. And we look at why our hair falls. So we look at why our hair falls is because something is wrong in the body that affects the hair cell, therefore the hair cycle and the hair falls. So a mother who has some other health problems potentially has another reason as opposed to the postpartum happening at the same time. It's important that you get professional advice at that time, one from a trichologist to help you with the hair cell and the hair cycle, and we also just do some checkups with your doctors to make sure everything in the body is balanced, and we must look at the nutrition, because if you're not getting proper nutrition, then it's going to affect your hair, your health, and also the health of the baby. So postpartum alopecia, normal part of pregnancy, but you can get help for it. So I hope that helps some women to understand what happens, and then we can put you back on the track to hair health after pregnancy. So the blooper before was the poster fell off the wall, so we pretended to just keep going. So I hope you enjoyed that little one, our cover up, but there you go.